Good morning and welcome back to our next session in MPHA's annual conference. We're excited to be with Jim Tasse this morning, Assistant Director with the Bicycle Coalition of Maine, who will be talking about low-cost improvements to streetscapes that can provide big benefits for public health. Before I turn it over to Jim, just another reminder that we are providing closed captioning, and you can find that underneath the video stream. If you don't need it, you can press the pause button. Also a reminder to continue taking those session evaluations by clicking on the feedback link in the upper right-hand corner. And we will be taking questions at the end of Jim's presentation, so please put those into the Q&A box and we'll get to as many as we can. But without further delay, I'll turn it over to you, Jim, and thank you for being here.
Great. Good morning, everyone. I have no idea who's here, how many are here, or where you're from, but it's great that you are here virtually, and I'm very happy to be here as well. I'm going to talk to you about low-cost improvements to streetscapes. The shorthand description of these are what we call tactical urbanism. So if you don't know about tactical urbanism, you're going to learn a little bit more after today's session. I am compelled to tell you that I have nothing to disclose with regard to commercial relationships in this presentation, although there probably are some delineator companies that would love to have me on board as a salesperson at this point. So my presentation is going to run through basically 5 points. I'm going to talk just very, very briefly about the BCM. If this were a live presentation, I'd say if you've heard of the BCM, raise your hand, but I'll just take it on faith that some of you have heard of us, but I'll tell those of you who haven't a little more about us. I'll talk a little bit about the built environment and its relationship to public health, talk a little bit about why it is necessary to calm traffic and change attitudes with respect to how we use our roadways. And then I'll talk about tactical urbanism, which is shorthanded as demonstration projects, or maybe it's longer-handed as demonstration projects. But tactical urbanism is it's a great title that makes some people nervous because it sounds like a military operation, and DOT is especially a little uneasy with that moniker. I'll tell you more about that momentarily. And then I'm just going to flip through a bunch of projects in Maine. And my goal here is to stimulate you and get you thinking about whether some of the communities you work with might be interested in exploring some of these installations as strategies to calm traffic and improve safety and access for vulnerable users. So if you don't know about the BCM, we've been around since 1992. We have explicitly had walking as part of our mission since 2015. So although we are the Bicycling Coalition of Maine, you can always think of it as the Bicycling and Pedestrian or Walking Coalition of Maine as well. We've got about 3,000 members, 3,000 to 5,000. We are the state's clearinghouse for information and resources about biking and walking in Maine, everything from infrastructure to law to safety practices. I just got a call from a sheriff's deputy last week wanting a clarification on law, and I was very pleased to field that call. We are funded by members, event revenue. We work under contract with the DOT and some other entities. We get grants and sponsorships. We're like your kind of typical nonprofit and blending together a bunch of funding streams. Primarily, we do events, education, and advocacy. Some of you may have heard of our big event called Bike Maine, which is a movable feast of cycling that moves around the state. It's been interrupted by COVID, but we've been doing other things to kind of fill those voids. We work with the DOT and other entities on legislation, on policy initiatives, and on community planning initiatives. And we also have a number of campaigns that are rolling right now. Our Heads Up campaign, Slow Me Down, is both things that we're doing kind of in partnership with the Maine DOT. And what I'm going to talk to you about today is another one of our campaigns, what we call our Imagine People Here project. So I wanted to start by just reviewing, as I assume some of you already are aware, that the built environment has a huge impact on public health. The statements, this is all from US CDC, and it really just succinctly kind of sums up the relationship between health and the built environment. The physical design of communities can improve or worsen health. When we build a community out, does it have sidewalks? Does it have inviting places to go and walk to and sit? Are there ways that you can safely navigate the roadway system with a bicycle? All of these things make a huge difference on how much physical activity a person is able to build into their day. And, there's some interesting and compelling research that says, the people who actually built physical activity into their days as just part of their routine, walking to the store, actually wind up having better health outcomes than those people who dedicate time to exercise. And so the built environment, making it possible for us to live our lives in ways that are physically active and, promoting us getting around, getting some good fresh air on a daily basis, really can improve health generally. But, the built environment has a huge impact on whether you're willing to do that. If you don't get out and walk and get active regularly, as you guys all know, you wind up with poor health outcomes. Obesity still running rampant in the U.S., and its comorbidities and associated illnesses, cardiovascular disease, diabetes, cancer, just continuing to ravage our communities. And I truly believe that we could do a lot to improve health outcomes in the U.S. by leaning into active transportation and making our communities more supportive of people walking and bicycling in particular. But unfortunately, having worked with the DOT now for 13 years, I can tell you that it is a truth that roadway design over the past few decades really is much more about cars than it is about people walking and bicycling. And all of these, well, let's see, the first two images that I have up here, the ones on the left are both from Maine. That's Cape Elizabeth on the left with my wife kind of contemplating, well, where am I supposed to walk here? And eventually a roadway, a path did get put in on Shore Road, which makes it much better. But as of this photograph, it was not there yet. The next photo over is actually Freeport. And that kind of rubbed in line is often called a desire line, which shows that people are walking there or biking there, but they're using the right of way, but there's no facility for it. And then the other images are just images that show, again, what you get when you don't think about anyone but cars. You get, bike riders feeling they need to dress up like traffic signs and sharing the road in sort of uncomfortable context. And certainly people with disabilities who are using wheelchairs really suffer if there's no dedicated infrastructure to make it safe and easy for them to get around. Just a couple of quick points here. Let me just close this up a little. There we go. That's better. The things that bring people to the built environment and invite them to walk in it are first and foremost the presence of facilities. If you don't have a place to safely walk, it's very, very simple to say, well, I'm going to take the car instead. And the intervention is an investment in multimodal facilities. You need to build sidewalks, you need to build crosswalks, you need to build bike lanes. Another factor that really plays a huge role in how much people are willing to use active transportation to get around is distance to destinations. And really the next one kind of fits in there as well, presence of services, markets, and businesses. And, land use policies that encourage mixed use development and human scale distances and facilities, create an environment in which people feel like, I want to walk there. It's convenient to walk there. It's safe to walk there. It's pleasant to walk there. And those are the kind of things that need to happen to really encourage people to get out and use their feet or a bicycle to run their errands and do their chores. And hand in hand with that, from the land use policy perspective, is permitting residential and business uses to exist in the same space. We're sort of suffering in some respects from old zoning practices that rigorously separate business and residential uses. But what we found is that situation just means that people have to get in their car and drive to the business district to get their services or whatever it is they want to buy. So when we design our communities and we think about mixing businesses and residential spaces, we create a context that's much easier for people to get out and use active transportation, improve their health, and fight the obesity epidemic. Related to things, to the willingness of people to use active transportation, for longer trips is, transit. I'm on the transportation work group for the Climate Council in Maine, and my ongoing referent has just been bike ped transit. Transit is possible, to link longer distances and get people to make trips that take them from community to community. But bicycle and pedestrian facilities are what solve that last mile kind of question. And that's how we often talk about it, is how do you get from the bus station to your destinations, or how do you get from your house to the bus station? And so it's very important that we have robust bike ped facilities, sidewalks, bike lanes, whatever it is, bike parking, that let people actually leave the car parked in the driveway and either walk or ride a bike to the transit node, hop on a bus or some other device and get to the next community that they need to visit. Certainly COVID has complicated that a little bit, and people have a little bit of unwillingness to jump onto a bus full of people. But, the research that I've been looking at indicates that the ventilation systems on most transit facilities of various types, subways, buses, all of them, they change air pretty rapidly and pretty regularly, and wearing a mask and, practicing the other kind of routines for safety that we're getting used to can all keep you, pretty safe while using transit, even in this era of the pandemic. Okay, here, hold on a second. There we go. Major challenges to active transportation that we at the coalition run into on a daily basis. I mean, I put speeding at the top of this list because, every single week I get another raft of complaints about speeding traffic, and what can we do about it? Distraction, people looking at cell phones, close second. Bicycle riders are particularly terrified of distracted driving because, you're on the edge of the road on a rural highway. Someone looks at their phone when they should be paying attention to the road, and it just takes a millisecond for them to drift into, the same space and cause a disaster. Roadway aggression. I think that we are seeing a sort of fraying of the social fabric that manifests itself in aggressive behavior on the roads. And I'm sad to say I do see more of it. Well, I hear about more of it. I think it is a problem. And I think that we really need to figure out ways to calm people's attitudes down out there. But it's all linked to that prevailing cultural attitude that roads are for cars. And, I've had people just blanket, just say that to me. It's like, bikes and walkers don't belong on the roads. The roads are built for cars. And that's, neither true nor really, justifiable. Roads are for people, not just people in cars. And we have some work to do to kind of change people's thinking about that. As I mentioned, lack of facilities definitely is a barrier to active transportation. And unfortunately, concerns over the cost of facilities is one reason why we don't see facilities installed more rapidly and more regularly. Here's one public health issue. The guy talking on his phone, drinking his coffee, barely driving. This is not just a traffic issue. This is a public health issue because people are getting injured and killed as a result of behavior like this. I'm just looking at my clock here, so I'm seeing I need to roll a little faster. So I'm going to just say, speed is a problem. And I'm going to invite all of you, as I do whenever I make a public appearance, to say, if you're in any context that's posted 35 miles per hour or under, drive 3 miles below the speed limit. I'm less concerned about what you're doing on roadways that are posted 45 and up, but roadways that are posted 35 and under are usually posted that way because they're contexts that are full of people walking, bicycling, or unloading cars or whatever. It's more of a human context. So drive slower there. BCM has a campaign running currently called Slow Me Down that is trying to change cultural norms around speeding. We're really trying to get people to embrace this idea of obedience to the speed limit in neighborhoods it's respectful and it's safe. So do more of that yourself. Be the change we want to see. As I've mentioned, roads are really designed for speed these days. And unfortunately, designers will over design a road so that they'll post the road at speed limits that are considerably below what the road is designed for. And this creates a tension between what drivers feel like they can do and what the law would like them to do and what the community sometimes would like them to do. As an example, downtown Westbrook, Main Street in Westbrook has travel lanes that are 15 feet wide. 15 feet wide is the same, or it's actually larger than most of the lanes that you'll find on interstate highways. And so you can comfortably drive in a 15-foot travel lane at better than 70 miles an hour. This roadway is posted at 25. So how many people do you think actually drive 25 miles per hour on a road that's designed with this kind of massive lane structure? It sends a mixed message to drivers, and drivers typically drive at the speed they feel comfortable at, not necessarily just what the law tells them to drive at. Here's another example of how roads are designed for speed. You'll often see the radii of corners really kind of, pulled back and kind of arced into the turn, which permits a car to just basically make that turn at a high rate of speed. And in this illustration, you can see that people are making that turn at such speed that they're scrubbing the center line just downstream of the intersection. The red line shows how you could redesign this roadway so that you would force a much more slow and deliberate turning movement into the roadway. And that's the kind of thing that we're often playing with when we do our tactical urbanism projects. For all of the issues that we identify as discouraging to people using active transportation, demonstration projects have an answer. They slow and calm traffic, they promote attention, they provide an alternative to roadway aggression by showing that people care about how fast people are driving and want to kind of slow folks down for the good of the community. They reclaim roadway space for people who are not driving cars. They provide facilities, and the demo projects are very inexpensive compared to a full-on built one. The term tactical urbanism was first coined by a Mainer, Mike Lydon, who's from Daramuscata, and he's literally written the book on tactical urbanism, which is basically the practice of using short-term demonstration projects in order to get people thinking about how to do something different. And again, I know there's some text here, but I'm going to keep moving just so we can get to some questions and I can show you some images of projects. But we really like demonstration projects because they allow the immediate reclamation of public space. We mess around with the roads and we show what is possible, how inexpensively and rapidly you can transform a community's roadway network. So this image here shows me painting the very first bike lane I ever painted as part of our demonstration project campaign. This is on Cottage Road in South Portland. So we just do what we call quick build demo projects to show how easy, possible, and cost effective it can be to improve safety and convenience for people walking and bicycling. Demo projects have the huge advantage of being something you can interact with. Instead of going to a meeting and seeing a projection of a plan or a photo rendering, you actually get something that you can use. And you can see this family on that bike lane I just showed in the previous slide. These folks showed up before we were even done painting the bike lane, and they were like, yay, there's something for us to use. And they jumped right into it. People get to interact with the installations. Our tactical urbanism project, we call Imagine People Here. We've been doing it since really 2014. At this point, we've done more than 32 projects in 23 different communities across the state. And I'm going to show you a bunch of images from some of our projects shortly. A couple other details, I have to call out AARP as they are huge supporters of the effort. LL Bean is likewise a supporter, and Maine DOT has been very supportive of these projects of late as well. All of our designs are based on national design standards. We don't just kind of do stuff that's, making stuff up. We actually try to really implement versions of what we can see in design guides. And that makes them much easier to sell to municipal leaders and to the DOT. Every project we do is reviewed and sanctioned by communities. They have to basically sign off on it and completely authorize it. For DOT projects, they're all reviewed by an engineer as well. So anything on a DOT road also gets reviewed by the regional engineer, and the DOT is actually, we've been doing so many projects that they've now developed a whole protocol that you have to abide by in order to propose a demo project on Maine DOT roads. And if you're interested in learning more and you have a project in a space like that, we can help get you through that process. We are trying a lot more to do what we call snap, speed, and yield studies, which provide some hard data about changes. So we do stuff that with a radar gun and with volunteers that shows both how what we do impacts speeds and willingness of drivers to yield. We always include public opinion surveys. Many projects have been made permanent, and they're compared to a hardscape project, they are extremely inexpensive. The projects I'm going to show you today are all sub $2,000. So this is one that's up right now in South Portland. This is on Preble Street at the intersection with Angel. You can see in the foreground here, there's a yellow painted curb extension. And what we've done here is we've sort of, established that curb extension as doing something real by putting down some delineators. There was a ramp on this side on the right-hand side of the road, and a low sidewalk curb on the left. And so we were able to get the city of South Portland to paint in a brand new crosswalk that we then enhanced with the delineators and created a little choke down area here to try and calm and slow traffic as it approaches the crosswalk. Here you see thank you. Here you see another gateway installation in Augusta, again, showing a kind of a way to choke down traffic as it goes through the travel lanes and calm it as it approaches crosswalks. This is a freestanding gateway in Mount Vernon that's on the approach to the downtown. And what this does, again, is it just creates some visual friction as drivers move into the village area. This project has been getting great reviews. This is a relatively new technique for us, but apparently it's having some success. Here is another gateway. And this is a striking one because you can see here with the black and white things, these are what we call temporary safe landings. DOT requires that a crosswalk land at a place of safe landing. And that's what you can see here. We created those using delineators and traffic stops. This facility here with the dashed lines is one on the other side that's a little harder to see, is an advisory lane. And I'll talk about that momentarily. This is kind of reclaiming a little urban space at Woodford Corner in Portland. And again, just sort of repurposing some excess asphalt. We want to actually eventually get a bike rack into that space up on the right. The lower installation just prevents people from making illegal turns against traffic on that traffic island down below. A couple more gateways. You can see left is the unchanged condition. Right is what we did up in Millinocket, again, to slow drivers down and make the crosswalk more conspicuous. Another freestanding gateway in North Yarmouth, and worth calling out the North Yarmouth project because here was a location where we took a context in which 67% of drivers were not obeying the speed limit and basically flipped it on its head. We, by putting in traffic calming implements, got people, 80% of the time to comply with the speed limit or be under it. This is again this is 2020 in North Yarmouth where we did some additional crosswalk, and this is a shared lane marking that we paint down. This is an installation that's proving very popular in Maine. It's called an advisory lane. Basically, it reclaims territory on the edge of the road for people to walk and bike in, and the sign here shows what's supposed to happen. Cars share this middle space, and when they encounter another car, they move to the right into that lane. But the idea is that they yield to bikes and pedestrians. And these have been done in about, I want to say 6 communities in Maine so far. We've done some wayfinding demo projects using zip ties and coroplast signs. This is a curb extension, changing the radius of a curb. I'm just going to flip through these quickly and get to a couple of last points before I open it up to questions. The left turn hardening demonstration where we're trying to get the cars to travel on the green line rather than cut the corner. if you're thinking about demonstration projects in your own community, you should be thinking about places where public support exists, and there's a desire for something. It's easier if it's on a locally controlled rather than a DOT controlled roadway. It's best if the location be at a spot where some planning or conversations about the need for a facility have already occurred. It has to have municipal support. If like I said, we don't do the project if we can't get the city to sign off on a statement saying we completely authorize this and it's our project. I think this penultimate one is one I want to call attention to. This is about simple places. You really want to create a situation where people kind of slap themselves in the forehead and say, why didn't we do this sooner? Demonstration projects are not intended to solve really complex traffic issues. What they're intended to do is slow traffic, calm traffic, and solve, less complex issues. And as I've mentioned, your project should always try to conform to national design standards. Process-wise, it's getting people, into it and concerned about it. Speeding comes up again and again. We do speed data with one of our 2 radar guns. If you're interested in getting involved, we can loan you a radar gun and get you an app so you can do your own speed study. You need to come up with a design. You need to get your permissions from the town and the Maine and DOT if necessary. Securing materials, we can help with that. Basically, every delineator is about $50 with adhesive. Most of our projects don't require more than 4 to 6 delineators. And then we try to install it and do some follow-up study. I'm going to stop here and get it over to questions, but it's not hard to do this stuff. A reminder that you need to be the change that we want to see in the world. Take your foot off the gas when you see a vulnerable user in the road. Drive slower than the speed limit in residential or village context. And please reach out to me at the BCM if you want to learn more about this program. So I'll stop talking now and answer some questions.
Thank you so much, Jim. And it's great to see some of those demonstrations that are right in my backyard. So thank you and to BCM for all the work that you're doing. One of the questions, and you talked a little bit about this, is besides the work that you all are doing, how can we help influence more walkable and bikeable streets? And at the end of the day, who's really the one that makes the decision on what gets included in an infrastructure project?
So, you have to be in touch with your community leaders, and frequently you have to be in touch with your political leadership. Like town councils have a huge impact on what town staff is willing to do. So if you get your town council or your select board or whatever, governing entity you have in your community to really value making the road safer for people walking and bicycling, that begins to trickle down and permeate into the other areas of community operations. Staff sometimes won't automatically make the change because they don't want to do anything that's too different from what they've always done, and they don't want to stick their neck out. You need to have the political support lined up to direct staff to say, this is important, make this happen. And that's probably the single most important thing you can do. Once you get some of the political people to support this, and the town begins to see that this can be done relatively easily and inexpensively, it can become a more self-perpetuating process. But if you really want to have your community be more walkable and bikeable, you got to get involved with the community processes that are governing the community and really kind of have conversations about reprioritizing how roadway money is spent. So it's not just on cars, it's also on people's needs for walking and biking.
Great, thank you. And another question about rural versus urban. Is there an equivalent tactical ruralism?
Kind of. So what you saw in Mount Vernon is the kind of installation we'll do in rural context, where we're trying to calm people down as they approach village cores or centers. And we've done this in North Yarmouth. We've done with those freestanding gateway kind of things, and as well putting crosswalk gateways if there's a crosswalk in the downtown or in the village center can, just sort of change the whole feel of the communities, that it's not just something we're just flying through in the car, but we have to actually slow down and move a little bit more deliberately. So freestanding gateways are strategies that we're applying on approaches to towns. Again, typically, we don't do anything on a roadway that's, in excess of 35 miles per hour. So, at the place where we're moving into the human scale context, that's where we set up our interventions to really get the cars to realize they're moving into a human scale context and they should slow the heck down. So yes, there are some things we can do in rural context, but it's usually as they're approaching the more built up areas.
Great, thank you. But it's nice to know that it can be transferred, especially in a state that is as rural as ours. Unfortunately, though, we're somehow already at 12 o'clock. We do have a couple other questions, but won't be able to get those today. So thank you so much, Jim, for being here. We really appreciate it. And a reminder to take the evaluation. And I think, Jim, you did provide your contact information if people have follow-up. And we'll be back at 12:10 to talk about I can't ever say this word, the politicization of public health. So we'll see you then. And thanks, everybody.
Thank you.